Hi, this is Nathalie with Vitiligo Friends, and today we're going to talk about the effects of natural health products on vitiligo. And I'm so honored to have our guest, Dr. Orest Szczurko, and he is going to talk about his work that he did on an article called A Systemic Review of Natural Health Product Treatment for Vitiligo. It's got a lot of great information for us. A little bit of background about Dr. Orest. After graduating from the Canadian College of Naturopathic Medicine, Dr. Orest has been practicing naturopathic medicine in Mississauga, Ontario, at the Noumena Naturopathic Clinic since 2003. For his research, focusing on alternative medicines and the treatment of vitiligo, he has earned a Master's of Science from the Leslie Dan Faculty of Pharmacy at the University of Toronto. Currently on research faculty at the Canadian College of Naturopathic Medicine and as Chief Director of the Noumena Naturopathic Clinic, Dr. Orest continues to see patients with vitiligo and continues research into helping patients with vitiligo. Welcome, Dr. Orest. Thank you for joining us today.
Hello.
Hi. So thank you for being here. So wonderful to talk with you. I've read your studies, and what brought me to you was finding a YouTube video about a young lady who says that she wore a magnetic bracelet and took Ginkgo Biloba and repigmented, and I wondered why that would be, because there's many studies out there and nothing has ever said that would work, and it seems pretty basic. So it brought me to your studies, and I'm excited to see that you had actually done studies on Ginkgo Biloba and its effects on vitiligo, and other medicines or natural health products as well. Can you tell us a little bit about what you did?
We have. In our review of alternative medicines for the treatment of vitiligo, one of the most interesting or intriguing findings that we found was a study done by Dr. Prasad in India several years ago that showed a pretty amazing success rate with Ginkgo Biloba for the treatment of vitiligo. He was quoting about 40% of patients that were treated with it that were improving by about 75% or greater. So this was done in India, which is, of course, a different environment than the environment that I practice in Toronto, Ontario. And so we decided to replicate this study from our point of view. So we provided patients with 60 milligrams of Ginkgo Biloba twice a day. Mm-hmm. And it was a small study. It was just a pilot study to see if it was worth investigating further. And the 12 participants that we treated, 11 of whom finished the study, they improved on their vitiligo by about 15%. So it wasn't as large as the study by Dr. Prasad, but still intriguing and worth following up on in the future.
Absolutely. Now, did you two things that come to mind when you started the study? Did the participants have to have vitiligo for no longer than a certain amount of time? In other words, did it matter how long they had vitiligo? Like, I've had it for 17 years now. Would that matter in the
No, in our study it didn't matter. We initially were looking for younger participants, those who
younger in age. Oh, sorry.
Younger in age.
Oh, younger in age. Okay.
Younger in age, those who had 12 to 18 years, but we couldn't find enough patients quickly enough, so we expanded it to 12 to 35 years old. But as far as the duration of vitiligo, it did not matter. They had to have a minimum amount of vitiligo.
And what was that?
It was about the size of about an inch in diameter.
Okay.
Most patients had a lot more than that, and that was, and they couldn't have any. They couldn't be treating the vitiligo with anything else at the time of the study. Those were the major inclusions.
So all they were taking was 60 milligrams was it milligrams or micrograms? I'm sorry, I didn't catch that.
60 milligrams of Ginkgo Biloba.
Of Ginkgo?
Twice per day.
Twice per day. And it was just regular over-the-counter tablets that we could buy at any grocery store?
It was, yes. Yeah.
And so your results were you saw 15%, and then the doctor in India saw a 20%. That's really not too far off.
No, the doctor in India saw 40%.
Oh, 40%. I'm sorry. That's right. Okay. And so did you continue studies then? Did you do more about that?
The study, it was completed in 2009. So in human terms, it's a long time, but in terms of studies, it was actually a short time ago. It took us a year to publish that result, and we're starting up a larger clinical trial to do it properly this time around. The first trial was a pilot trial. It was just to see whether there was any effect or any possibility of effect, and we obviously found that. So this time around, we're planning on making a larger trial, so in the area of 40 to 100 participants, and we will have two groups, one group which will get the Ginkgo Biloba and the other one which will not get any Ginkgo Biloba at all. So it'll be randomized, and it'll be double blind in the sense that everybody's going to get pills. Half will get the active ingredient, the ginkgo, and half will get just a placebo. And we'll be able to compare whether there is a true effect or not. One thing that's interesting is in terms of the dosage. This time around, we will probably use a higher amount of Ginkgo Biloba. So we'll probably use 120 milligrams twice a day. When you look at the literature for just general use of Ginkgo Biloba for other concerns or other illnesses, that's the common dose, is 120 milligrams twice per day.
All right. Okay. Now, I want to also extend to you, whenever you are going to start recruiting people, please do let us know here, and I can put the word out, because I know that as soon as people listen to the podcast, there's going to be a lot of them are going to request how they can participate in this. So if you could get us the information when it becomes available, and we have a lot of listeners in Canada, and so we might have a nice pool for you to get this time. It'll be a larger, you get enough people this time, or a larger group. That'll be wonderful.
Exactly. Thank you very much. I will certainly take you up on this. One of the biggest concerns when we do research is actually funding and of course patient recruitment.
And sticking with it too.
Pardon?
And people sticking with it too. I know I have a hard time doing that.
Exactly.
sticking with something. I'll take vitamins, but I'm just not very regular about it. But I know that if I heard that it was, or obviously if I were part of a study, I would be better about it. But that is something that's probably very difficult in your studies, isn't it, to make sure that people are consistently doing what they're supposed to do as part of the trials?
You know what? In usual studies, that is the case, but I find that both my patients with vitiligo and the patients who we treat in the studies are very, very motivated. Yeah. So they follow through a lot better than other patients. It's still difficult. It's quite hard, but it's better than some of the other studies that I've done.
It's such an emotionally debilitating disease that I can see where it is definitely worth every effort when you're especially participating in a study, because you know that there's something behind it. There's a reason that there could be a light at the end of the tunnel. Do you find that with your patients that you do treat vitiligo patients? So when they come into you, what is the first thing that you tell them as far as how to handle it emotionally? Am I throwing you a curve here? I'm sorry.
No, it's no problem. About half of my patients that I treat are at my private clinic in Mississauga are patients with vitiligo, and I am a naturopathic doctor. I'm not a medical doctor, so my approach is very different. So one of the reasons I started researching vitiligo was because of the effects that I've seen from the patients who came in, and it is a very psychologically debilitating illness. The good news is, as I'm sure you know, it's beyond the cosmetic, which of course affects the mental and the psychological and the societal impacts. Those are tremendous. From a physical point of view, it doesn't have any effect. So it doesn't have any, it's not like it can be spread to anybody else or anybody can catch it. And even the genetic links are not as strong as you would expect. So I always, when patients come in, I always explain that if it does make a huge impact on it does have a major psychological impact, definitely, and I see that time and time again. Mm-hmm. But at least the good news is that it doesn't, and that's one thing that the lay populations would ideally understand as well, that it's not transmitted, it's not,
contagious.
Catch it.
Mm-hmm, mm-hmm. Do you run across the issue of people worrying about how they are going to adjust in life, like going to get a job, and that they have issues with that? And what do you recommend to them when they have these emotional blocks from society? Do you tell them that they should seek therapy to find different therapeutic methods to deal with it, or exercise?
I do. Well, it can. I do recommend lifestyle aspects to. Well, usually when people come in, the first thing they want to do is deal with their vitiligo, and I can usually help them with that. So to help to stop the progression of it, and to help to repigment it. Mm-hmm. That's a very difficult and a very long-term process. But once you see that there is at least a little bit of movement forward or a little bit of improvement, you like you said yourself, you kind of see the light at the end of the tunnel. So that improves the emotions, that improves the outlook. Of course, other aspects of lifestyle are important. Exercise is critical. Diet is actually very important, both in terms of the mood, but even in terms of the aspects of vitiligo. And even a lot of the pressures come from societal pressures. I just had a patient who returned from Mexico, and he's around 40 years old, relatively good looking, but he had vitiligo throughout the body, and he was quite frustrated by people, staring at him as he was walking around. So in those cases, even cover up as a temporary, short-term solution can be quite effective. It stops those stares, and it stops that stigma that some people can portray.
Right. Oh, absolutely, absolutely. That's what I use, and I've been using mine for 9 years, and it has made all the difference in the world to me, because I don't even think about it, unless I'm making videos, and when I want to show the vitiligo to just to make other people who are watching the video know that they're not alone, know that I do feel for them because I have it. Other than that, I just don't think about it whatsoever, and that really is a good peace of mind for me. And then you can set it back and then just deal with trying to find something that's going to help repigment or slow down the depigmentation. Now, in your study, it wasn't just Ginkgo Biloba, right, that you did different tests on, or did different studies with?
There was the clinical trial that we did was just using Ginkgo Biloba.
Okay.
Before publishing the Ginkgo Biloba trial, I did a systematic review, so looking at the overall literature to see if there's anything else, or overall what is available in the treatment of vitiligo from the alternative point of view. And we did find a number of things. By the way, both studies, if you go to PubMed and you search by my name, you will find both studies, and we made sure to publish them open access, which means
wonderful.
that anybody can download it and anybody can read the studies. They're 9 pages and 12 pages each. It's pretty technical, but I'm sure most people can read through it and understand what's going most of the ideas. And, by the way, when people do access these studies, it's tracked. It's not tracked who's looking at them, but it is tracked how many views we get. Mm-hmm. And then when we go and when we apply for funding, what we can do is we can say, look, this article was highly accessed, which means that lots and lots of people are reading about it, so there's a lot of interest in it, so it's worth funding this kind of research. And actually, both of these articles that we published were very quickly rated as highly accessed, which is the highest category. I did want to run through several things that we found. To be honest, Ginkgo Biloba was the most interesting, or the most...
Showed the most promise?
Exactly.
Excuse me, 1 second. By the way, listeners, I am going to post that information that Dr. Orest was just talking about for the PubMed. I'll put a link on our show page so you can go directly there. And thank you, too, for that great information about the more viewers you have, the more interest is shown, the better the chances of getting the high funding that we really want to see. And I never even thought about that. So that was good. I'm glad to know that. Now, please tell us about the other studies.
The other findings.
Mm-hmm.
So in the clinical trial, in the systematic review, we looked at over 986 specifically citations. So that many articles that included the words vitiligo and that were discussing its use. There were 47 in total that we looked over, but of those, only 15 were actual clinical trials that included natural health products, so things like vitamins, herbs, or supplements, etc. And there are a couple, you could lump them together into a couple different categories. Some used phenylalanine, some used traditional Chinese medicines, some used herbs, and some used vitamins. The other supplement that you could say that shows the most promise was phenylalanine, and there's a lot of research done on that in Germany, and they tend to use it along with phototherapy.
Okay.
So they'll give the phenylalanine just before the narrowband UVB or the UVA treatments, and they find that it helps to produce the melanocytes. And there's actually a pretty good scientific pathway to that. So when your body produces the melanocytes, it needs phenylalanine as well as a couple other things. And when you provide that, the body tends to repigment faster. But one thing that I find in my practice is that the entire body tends to repigment a little bit faster. So that is something for people to be aware of.
So your
what that means
skin will get darker?
Yeah, exactly. So usually, the contrast between the vitiligo areas and the normal areas is pretty good. If it's a minimum contrast, so if both areas are light, that's not so bad. But if you take the phenylalanine, your regular skin will get darker as well.
Okay.
I would caution people not to use phenylalanine. I would actually caution people not to use any of these on their own. Seek professional advice. A naturopathic doctor will be most familiar with these alternative medicine products, just because some of them can have adverse reactions, or if in certain cases you can have certain problems. so phenylalanine, for example, can be hard on the kidneys. And there are certain people with PKU, phenylketonuria, which can have, it can actually cause quite a severe reaction. So you just want to make sure that you're okay from that point of view. And just to jump back to ginkgo for a second, it can, it does dilate the blood vessels, and what it can do is, I mean, some of the minor side effects can be headaches and things like that, but one of the major is a higher risk of bleeding. So if you cut yourself or if you have any of the bleeding or clotting disorders like hemophilia and others, then it can actually aggravate that. I don't often see that in practice, to be honest, but you always want to for it.
That was my next question. If you had, if there was anything that ginkgo that we needed to be careful of when taking Ginkgo Biloba, because I mean now I'm gonna start taking it just to see on my own, and I'm sure a lot of people listening will try it also. But it's always best to make sure that you are physically able to handle that, and so never go overboard. Obviously, 60 milligrams twice a day is what the study was on, and to always talk to your doctor before you try anything like this. Okay, so please continue.
Just to finish that thought, if you, just for you and for your listeners, if they print the article and show that to the medical doctor, even in the abstract, one of the things that we check to make sure that we were safe in administering the Ginkgo Biloba are three things called platelet count, PTT, and INR. And that's a really easy blood test that the doctors can do. And you do that before you start the Ginkgo Biloba, and then you can follow that up within a month or so, and just make sure that you're okay.
Okay, yeah, that's wonderful.
So just to, sorry, I took you a little bit off track, but just to touch base on what we found. So the major categories, the phenylalanine, the traditional Chinese medicine, herbs, and vitamins.
Oh, yes.
I touched on the phenylalanine already. The traditional Chinese medicine was very hard for us to evaluate. We weren't really able to draw any conclusions per se. They're usually combinations of 15 different herbs or 10 different herbs, and the quality of the studies was quite low, which meant that we weren't sure if the actual ingredients that they said would be in those test products were in those test products, and just the way they followed up with patients wasn't ideal. So I can't really comment that much on the traditional Chinese medicine.
Okay, sure.
The herbs of the most interesting was the Ginkgo Biloba. There was one study.
Did you ever do any studies with ginger root?
No.
Because I have done my own little experiments here, and I put ginger root juice on the skin, and I did notice slight pigmentation, pinkening of the skin, and that could just be because the skin maybe was the acidity in the ginger root. Although I didn't have any pain or itching, but it did get a pink, and then I did have a few little spots of pigmentation, and that was all I experienced because I did it for 1 month, and then moved on to another experiment. However, I did have a lot of readers try it. Well, a lot. I'd say a handful, 5, and they did experience repigmentation.
Oh, wow.
That might be something that we could try with you, too, just ginger root.
Yeah. Well, thank you. I'm just writing it down, actually. Thank you for that tip. I will look into it. When I did my published literature research, I haven't come across that at all. I'm just thinking of the mechanism. One of the ways you want to, it's possible that the ginger root juice sensitized your skin to make it more sensitive to any sun or any phototherapy that you do.
That's a good thought, but I wasn't in the sun.
Oh.
Because I did this experiment. I'm going to send you a link to the videos on YouTube, but I did this experiment, I think like in April, May of this past year, March, April, May, something like that. So it's not pleasant to be outside just to to take a tan or anything like that. Maybe going to my car and to the house or wherever I'm going. That's it. So I didn't do any outdoor activities. So it would just be below average sunning. So that's what intrigued me, because I knew that I had done eczema light treatments, and my skin did repigment. I experienced some repigmentation with that, and as soon as the treatment stopped after 18 months, it faded completely.
It all went back to the way it was.
Yeah, it just went back to what it was. But the good news is that your skin's repigmentable. It's not the whole thing isn't just a dead thought anymore. You can repigment. It's just a matter of, is it a matter of like getting the gene or the mechanism of the cell to turn on? Is that what the problem is? Something's off, but it needs to switch on?
You know what? That's actually a very, very good question. Well, I find this. I found this very, very often in practice. And that's kind of the standard medical approach. Is when you come in with vitiligo, they'll do one kind of phototherapy or laser, or even they'll do surgery. And there's lots of research that shows when you do that, it's effective. But as soon as you stop, within 6 months or a little longer, the body brings it back to the way that it was before.
Mm-hmm.
And I think the fundamental difference there is in approach. So from my perspective, as a naturopathic doctor, we always want to look for the underlying cause of the problem. That's what we're trained. That's one of the strengths. And what I find, it's well known and everyone agrees that vitiligo is an autoimmune disease. So at its fundamental, it's the immune system that's overreacting. So my focus in treatments is to identify what's triggering the immune system to overreact. So what's causing it, and then you eliminate that trigger, whatever's causing the overreaction. Then you support the immune system to calm it down, to keep it happy, just in general. And then the last step is to induce repigmentation, usually with the laser or the phototherapy. But it's those first two steps that I find most dermatologists and even most medical doctors, not to poo-poo on them or not to look down on them at all, but it's a different paradigm. So they don't usually think of what's causing it. They just think of it as an immune disease, so we need to shut down the immune system. So you apply the tacrolimus or or cortisone or any of the other creams either locally, just to shut down the immune system locally. But then as soon as you do that, the vitiligo comes up in another area. Mm-hmm. So identifying what's triggering the immune system is one of the most important things.
Just in about 1 minute, it might sound like the show's going to end, but we can continue talking and ignore that they're playing that music. So do you mind staying around?
I have a few minutes. But
okay, wonderful. Mm-hmm. So now I've lost my train of thought because I was worried about letting you know that. Okay, going on with the autoimmune that you were just speaking of, treating the whole body also. Like you were saying, that the doctors really just try to, here at least, patch what is going on, fix it, but not the underlying issue. And that is something that I wish you lived closer, or I live nearer to you, so I could come into your practice and see what it is, because that'd be very interesting to find out. And because there's so many different triggers for the many different people, it's really hard to just give a blanket, this will help people with vitiligo, because what may be the underlying cause for me is not going to be the same for everybody else, or 10% of the other people may have the same thing. So that'd be very interesting to find out what that cause is. As far as it being called autoimmune, and I'm sure you must have a lot of patients that worry about this also. I have a lot of people that wonder if they have one autoimmune disease, and a lot of people also have hypothyroidism.
Yep.
If that means that now they have vitiligo, classified as, autoimmune, that they're going to get all the other autoimmune diseases. What do you say to patients when they come to you with that kind of worry?
Usually they don't have all the other autoimmune diseases. Usually they don't have almost any other autoimmune diseases. There are a couple connections or a couple links. One is the hypothyroidism, and I suspect that the mechanism might be similar. So the thing that's triggering the immune system to overreact to the skin, causing the vitiligo, I think is often similar. That's causing the body to overreact and attack the thyroid or cause the thyroid to be weaker. The other not common, but the other association in terms of autoimmune is sometimes Crohn's or celiac or some other digestive disturbance is seen or I see in clinic.
Okay. Go ahead, please. Sorry.
Those are usually kind of the three, or that's one of the connections that I often see associated with vitiligo.
Now, with the celiac disease, are you finding that connection because, and then also the lack of B12? Is it because your stomach is not able to process or allow the B12 to get through from your natural foods and then into your bloodstream, and so then it causes all sorts of mayhem with that?
Exactly. I think let's break it down into kind of a couple major things. So the main causes of vitiligo, just broadly speaking, are, from what I find, is for sure stress has an effect on it, and lifestyle and dietary aspects. And I think what often happens, and this is literature shows it, and that's actually literature. And the other aspect to vitiligo is actually chemical sensitivity in certain cases. Mm-hmm. So research shows, for example, there's a really interesting study that showed that while the normal percentage of celiac disease within the population is around 1 to 4%, usually on the 1% aspect, there's about 17, 18, almost 20% of patients with vitiligo have celiac disease. And celiac disease is one of those diseases that isn't it's not easily found. Most people are underdiagnosed, so most people walk around and they think they're fine, but many people have celiac disease who don't know about it. And in the case of celiac, it's the gluten or it's the wheat that is irritating the digestive tract, destroying the villi, which are the absorptive organelles within the intestines, and that's not allowing the nutrients to go in. And I think that's the link with vitamin B12 and some of the other nutrient deficiencies that tend to be helpful with vitiligo. Not always, and it usually takes a long time because it's just trying to, orally you're trying to force the vitamins in, but if you're having a hard time absorbing them, then you're not always absorbing everything.
Yeah, exactly. It doesn't matter how many you take, it's not going to be absorbed properly.
Yeah, and until you find out whether that disease is a concern, whether that, for example, whether that celiac is irritating the digestive tract, that same irritation can irritate the immune system. So that can be one of the triggers that cause the immune system to overreact and manifest as vitiligo as well. So it's kind of a complicated picture, but there are many things that impact each other.
This has just been so wonderful. And, I can't tell you how difficult it is to find a doctor, and I'm not the only one. I get people writing this to me all the time that they haven't found somebody who seems knowledgeable in vitiligo. And is there anybody who really cares about vitiligo? And I am just so impressed with your depth of knowledge, and your patients are so very lucky to have you nearby and available for treatment, because you're just a fountain of information and empathetic with the plight also. You seem to have a very deep understanding on the whole, which of course follows your naturopathic medicine choice rather than it's just wonderful. So I'm so very pleased to have had you on our show, and I'd love for you to come back again. And any time that you begin your new trials, give me a call or an email, and we can put the word out. And I'm sure your 40 to 100 people positions will be filled quite quickly, very quickly.
That would be wonderful. That would be great. Thank you very kindly.
Oh, it's my great pleasure, and I hope to talk with you soon. Thank you so much.
You're welcome.
All right, bye-bye.
Bye-bye.
Thanks, everybody. We'll have a wonderful day today, and we'll get back with you next week. Bye-bye.